The prenatal care funding issue, we recently...
At the state level with Medicaid?
Yes. We recently attended a forum at UNMC from neonatal healthcare practitioners, and with the math that they did, for every dollar spent in prenatal care, it will be $2 to $3, and that's a low estimate in what they'll be spending on these babies that don't get prenatal care. So first of all, what's going to be done to deal with that cost, and second of all, what's going to be done for the quality of life for babies that don't get any care whatsoever?
That's a major issue, and on the question of prenatal care, there's been a commission that the governor put together a couple years ago, and we have staff on that. Our infant mortality rate is too high in the metropolitan area. We've been actively involved in that and making sure that there's access to health care. The issue about the state's interpretation of Medicare law, I think that's being reviewed right now, and I think that will work out. And for those of us, we can interject another controversial issue that are pro-life, that transcended and wanted to make sure, because being pro-life also means you support prenatal care. And so we want to make sure that those women receive prenatal care, because it is about that job.
Well, and what's being done right now, because as of right now in this area, there's 6,000 women without prenatal care. So what's being done for those women right now? Are they supposed to just wait until they go into preterm labor? You know?
I'll pass that on to the governor. I'll be talking to him later this week to get, it is a state interpretation, so you got to work with the governor on
There was a bill introduced yesterday. They waived the rules and introduced a bill yesterday to address that very problem. And I don't think there's a hearing date set yet, but follow it. It was introduced by State Senator Campbell.
Thank you, Bob. I appreciate that. Yes, sir, in the back. You've been very good.
The name, but I heard it in the morning news. First of all, there's two easy ways of reducing health care costs. One is to involve the patients in taking responsibility for their health care costs. You don't need everything that the doctor suggests, because one of the things he has to suggest is that if he fails, he's going to be sued. But one is taking personal responsibility, the other is rationing, and that's what the government plan to do, is ration health care. There are a number of reasons why you have high health care costs. One was involvement of the government back at time when Medicare. At that time, whenever the government subsidizes something, costs will go up, whether it's college education, whether it's health care or whatever. People vote for the green tree where dollars are being handed out. So one is subsidization. The insurance companies are involved, obviously, but don't just demonize the insurance companies. Labor unions, when they started giving full coverage, this increases the cost because they have no responsibility. So the area of government, business, labor are all involved with why we have factors involved in this high cost. The other point I wanted to make is that I'm all for the plug for partisanship. I think it's great. Yes. I am a partisan for the free market constitutional system. And about 100 years, we have been going further and further into socialism. And Republicans have partnered in it much of the time. There has been too much bipartisanship on the slide into socialism. But we are on the verge. Medicare, Social Security, about a $55 to $60 trillion debt what's been squandered. The corruption in our government now is just incredible. Absolutely incredible. We don't need any debt commission. All they need to do is to stop spending. Yes. The present Democratic administration and the senators all have voted for the radical, socialist, collectivist, statist approach, which takes away our freedoms. Our freedoms do not come from the government. They come from our Creator God.
Amen. Appreciate all of that. And I will agree. I will be a partisan on principles as well. You, and then you're next.
I enjoyed very much what you had to say, and I do ask, why is there always the assumption that we have to spend more? What is the problem with saying, cut spending, stop spending, we don't have the money, we all know that, we all know we're in debt. And I think back to the 90s when the Republicans were talking about slowing the growth of the spending, not cutting it, but slowing it at a slower rate, and they were accused of cutting school lunches or whatever.
Zero-based budget.
And I don't like this assumption that why shouldn't we pay more? If we have less money coming in, if our costs are such, we do without in our household. You don't keep spending when the money runs out, or you're in debt. I don't want to be in debt. There's nothing wrong with saying enough is enough. That's
I am here to represent results, and currently 75 million primary age children are shut out of the classroom. And Nita Lowy of New York will be introducing legislation, the Global Fund for Education, that will create the infrastructure that you know is so important, that will increase global funding commitments. Our fair share would be 5.3 billion, these 75
Are
million.
those 75 million American kids or?
Yeah, let's just. Or worldwide.
We are a very privileged
worldwide.
country, and I think we take it for granted that our children will have education. This is around the world. This infrastructure, the Global Fund for Education, would have the coordination, transparency, and accountability. The total cost of this program to put 75 million children in school is $16 billion a year, and that just happens to be the same amount that Goldman Sachs paid out in bonuses. So I do have it in a letter here, a few of the details, and I will get that to you.
Molly or who's ever closest will you get? All right, Mr. McPherson. Oh, I'm sorry. He's going.
Getting back to the gentleman's question on the Constitution, how can they ignore the 10th Amendment? The Constitution gave the government just a handful of things to do, and the states do the rest. But now, the problem with that is, Nebraska will say, well, we don't have to do this certain thing. Okay, fine. But you lose $100 million, $200 million in highway, it's blackmail. And they do that with everything. You know, we don't want to do it.
That's about to stop.
Don't take the money then.
Yeah.
Don't take the money. That's the solution.
Well, that's
Right.
fine. If they-
Don't turn it down.
Yeah, it's the, I call it the 10th Amendment, the forgotten amendment.
Yeah.
Pat?
It's just, I'm glad I'm not in your spot. There's not a person in this room that doesn't care for the needs of their fellow citizens in this country, whether health care or not. But the bottom line is we just cannot continue an unsustainable rush to bankruptcy in this country. And that's where we're going. And until we get those financial things under control, we can't afford the other. We've got to make that decision, as hard as it is, and that's what the crisis